Establishment of the 53-bed capacity hospital became necessary with the conversion of Tamale Polytechnic into a technical university. Yakubu Abdul Jalil is designated hospital administrator.
The whole idea was for a clinic, but upon the registration process, when we started with the registration process with Ghana Health Service and then National Health Insurance Authority, then the registration with other regulatory bodies like Fire Service, EP, something came up that the facility that we had was capable of containing so many patients who were just looking at it that it should be a clinic. But upon the registration process, we realized that it was a 53-bed capacity. Why not just commit ourselves? Why not commit ourselves so that we can just improve upon the services that we could be rendering to meet the demands of a hospital? So the hospital came in at that time where they said we needed to do a laboratory, we needed to do a theater, we needed to do a labor ward in that particular manner. So we adjusted the facility to meet that particular requirements.
It took 10 months to complete work on the structure for the hospital, which would serve as learning center for soon to be introduced specialist programs.
We believe that this is going to be a learning center for our students because currently we are developing 3 proposals. 1 proposal in BTech in laboratory technology, BTech in dispensary technology, and then BTech in biomedical engineering. So with these 3 programs, our thinking is that we need that to come out with a faculty of health and allied sciences so that it will be added to the 3 original faculties that we have within the institution. When that thing came into being, the management of the institution decided that why not we do something which will be different from other health institutions. So we decided that we should do what we call folderless and then paperless system. By bringing a software, by the click of a button when a patient visits the hospital, you're not going to do anything like a folder. We'll just use a webcam, then we'll snap you, upload it onto the system, then it goes through the system within the hospital. That is, if you go to the OPD section, then they capture you, take your details by your personal information, your name, your house number, your phone number, in that particular manner. It gets to the health insurance desk, it gets to the consulting rooms, it gets to the pharmacy, it gets to the nurses in the wards, it gets to the lab. It comes to the administrator, it goes to the cashier or the key point. So within that cycle of the university hospital, everybody has access to the patient in question. So we are thinking that the maximum minutes that you can spend if you are an outpatient within the university hospital should be 45 minutes.
The hospital software would also provide tablets in every ward for monitoring activities of nurses on duty.
The tablet system that I was telling you, each particular ward or each particular unit, the tablet will be placed at the nurse's sitting arena or sitting place where there will be keyboard. So where the tablets will be placed here, then the tablets will be programmed by using the bed numbers of the patient. Any patient who needs, say, special attention, or it is the time for medication for patient bed 1, then the tablet will beep. Then the nurse on duty will come and log on by using his or her username as well as the password. Now when you use your username and password, then you go and give the medication to the patient on bed 1. In future, if there are problems, we can trace onto the system to know that it was nurse A or nurse B who attended to patient bed 1 when the patient needed special attention around this time. For example, If it is time for medication for patient bed 1, it is going to be, say, 10:30 a.m. 10:30 a.m. If you are the nurse on duty, you use your username as well as your password. Then you will give the medication to patient bed 1.
All equipment for the hospital has been installed for full operation after the official opening. Mahmud Mohammed-Nurudeen reporting.